respond and ask questions. We have invited Nick Macchione, Head of Health and Human Services, and Dr. Wilma, the Public Health Officer for the County of San Diego. And we want to focus this evening primarily on the issue of vaccine and vaccinations, because we know we have a tremendous problem in the African American community in particular, in terms of people wanting to take the vaccine. And I have been really surprised at some of the people that I've talked to who have indicated that they didn't want to take it, that they wouldn't take it for various reasons. And so our effort this evening is to have some discussion, and it's a very necessary discussion because several weeks ago, I wrote a historical piece about the Tuskegee experiment, the 30 or 40 years following it. I also dealt with what happening with the sterilization efforts. And what we want is, we don't want a community based on history making decisions that are life-threatening in real time today, when we have African-American scientists, researchers, and doctors, and it's a whole different scenario than it was during those 40-some years with Tuskegee and during the 60s with the sterilization programs that have taken place. And so we want to have Dr. Wooten and Mr. Macchione talk to us about the vaccine issue, and we will take some questions after their discussion. But I want to raise a particular observation, Dr. Wooten, going into this. One of the greatest things that happened with the approach was when you signed the public health order that authorized everybody to get tested without having to go to a particular doctor to get a prescription. And I really feel that it looks like we're going to have to find a way to do something similar with the vaccine, because the African and African American communities, they are not going to hold and go through that whole appointment process. And I know from some experience that some people are just spending an inordinate amount of time on the phone. They get frustrated. And then we see Facebook postings of surplus vaccine and people showing up waiting so that it won't be wasted. So maybe in the course of the evening, you can address whether or not it's possible to do such an order that will help us get shots in the arms for people. And so I would like to yield to you and Nick during this time, and to the audience, we will take questions after we do that. I'm joined by our managing editor, Latanya West, here, because she's a person who is really responsible for all of the layout and the COVID information that you'll see in the paper, the health ordinances. And today we have a whole series of pregnancies and otherwise. And so, Latanya, do you have a comment or something before we start?
No, just welcome everyone. And we're just really looking forward to having a real useful, in-depth, and helpful conversation around the vaccine. I know there's so many people, so many questions that people have, including myself, about the whole process. We're in the next step of our journey through this COVID-19 crisis, and really looking forward to learning more and sharing that information with everyone.
Okay. Dr. Wooten or Mr. Macchione, whichever one you want to go first.
I'll bow to Dr. Wooten first. Thank you, Dr. Warren.
Okay.
Well, thank you, Dr. Warren, for that question. And in this particular case, issuing an order that no one, in this particular case for vaccinations, you don't need a doctor's note for that. But because we have limited vaccines, we want to make sure that the groups or the priority groups that are open for getting the vaccines get them, so that we were asking them to make the appointment. So that, and I know that might be frustrating for people, but it helps us to ensure that individuals are being vaccinated with the resources that we have available. If we had unlimited resources, it still actually would be a problem if people did not make appointments, because then you couldn't plan for the day. And you know, these vaccines are very delicate, particularly the Pfizer, that has to be maintained at ultra low temperatures. Actually, 70% Celsius and 94 degrees, not percent, 72 degrees Celsius and 94 degrees Fahrenheit. And then once you refrigerate it, you really only have a small window of time to utilize it. So that's why it's very important for people to make the appointments through the various systems. And I know that there are various systems. We have about 3, but we are all working to move all of those systems to My Turn, which basically means that when you make your first appointment, very soon thereafter, and sometimes at the same time, you get your appointment for the second dose. So that's where we are. That's my response for that, Dr. Warren.
Okay.
Nick, I don't know if you have anything else to add.
No, I think you covered it well, Dr. Wooten. I think I'd add that the prior federal administration really, didn't provide the type of planning. So I would add that, the accountability that they held. Now the Biden administration is trying to make up for it in a big way, giving us more vaccine. But the prior administration and this past year didn't lay the groundwork and really left it to the states, in our case, state of California, and then left to the locals. So there was a feeling, right, of scrambling, but in the urgency of that, of scrambling and standing up, and I know we'll get more into the discussion on that, of where we put our vaccination sites and how we follow then the CDC, and I think Dr. Wooten will talk about that also, the CDC and the California Department of Public Health guidance of how we follow the prioritization of the vaccine. We wish we had more time. We wish we had more, but the sense of urgency for us was moving quickly. So I really appreciated, Ms. West, what you said about getting shots in arms, exactly. But we need to make sure we do it in an equitable way of getting shots in arms. So we'll talk more about that.
Okay.
Question.
Yes, go ahead.
So what is it county, is the county distributing everything? I've just been seeing, I know we have the county sites, but as I walk into a CVS store or even to a Vons, I see these signs saying, get your vaccine here. So there's the county sites, and then how else is it being distributed, and how do people find out about where those places
So vaccines, yes, vaccines come to our region in several ways. There's vaccines that come to the local health jurisdiction, which is our local health department. And we order vaccines that are then also allocated to providers that have signed up initially through the CDC platform. Now it's CalVax through the CDPH, California Department of Public Health. And so that's the way vaccines are ordered. We actually submit first doses are ordered at the beginning of the week, second doses are ordered today. So we order allocations twice a week. And so there's local health jurisdictions, several providers are signed up. We get the vaccines, we push it out to those providers. Then there are what's called the multiple county entities like UCSD, because they have hospitals all over the state, Kaiser systems all over the state. Those are the multiple county entities. They get vaccines directly from the state. And then there's the program that CDC has with CVS and Walgreens, and CDC sends those vaccines directly to those two pharmacies. Now, you may have heard in the current administration that they will soon, as soon as next week, or it may have already started, send vaccines directly to local pharmacies. Now, before that, and it's only actually two, it is Rite Aid and CVS. Locally, as part of that local health jurisdiction, we have signed up pharmacies. So pharmacies that are in Ralph's or Vons, other small community pharmacies also get vaccines from us through that local health jurisdiction supply. So there are 3, and actually 4, but we don't know the numbers for the 4th. But again, the local health jurisdiction comes to the county. We help providers enroll, and we distribute vaccines to those providers. Then there's the multiple county entities. And then there is the CDC partnership with CVS and Walgreens. And then there's federal vaccinations through the military, through the Veterans Association, and even correctional facilities. So those are kind of the 4 big buckets of how vaccines get to our region. The dashboard that Nick and Supervisor Chair Fletcher talks about, either at the board meeting or at our briefings, that information is primarily, the numbers are primarily what comes through our local health jurisdiction, and it also includes the multiple county entities. Nick, anything additional there?
Yeah, we couldn't have made it more freaking complicated than this, how this was developed. I mean, and let's speak to the truth here. This wasn't our doing, us locally. It's frustrating. It's frustrating for us to administer it. It comes in different ways. We don't have the data. So what we attempted to do, and all we know how to do, is how do we make it as easy as possible? So we stood it up with 211, and we, Dr. Wooten put on the website. So, we try to, like we did with testing with T3, go to a place and then look for, one that lives where you live close by or where you work nearby. So we did all that. We stood that up locally, trying to make, and we still need more improvement, but we tried to be transparent of where you can go. I wish we could be the day, and maybe we will down the road when there's enough vaccine, where there's no appointments like testing, but right now, to Dr. Wooten's point, it's a scarcity, and therefore we have to do it in this kind of appointment manner. But we encourage people to go to 211. I mean, then there's this other title. I didn't make up this name, but it's called the Vaccination Superstation SD.org, a mouthful. So I just tell people, go to 211, and seriously, go to the website. They'll link you right to vaccinations. There's even a site, Ms. West, for people who got their first shot and don't know where to go for their second shot. There's a section there also for second doses, because least we forget the complication of the vaccines we have are 2 shots.
Yeah.
So, it couldn't have been more complicated, but I appreciate the question, because yeah, we are trying to simplify something highly complex and a lot of it out of our control, but trying to get to our people, right? Trying to get our folks vaccinated as best we can.
And I think also making sure that people are going to legitimate sites too.
Oh yeah.
One of our staff members had found something on Facebook about some drive-through vaccination place, but she she couldn't tell, was it legitimate or was it just some scam,
Well, can I just, for raising that, any place that charges you, walk away. There should be no site that charges you. First, number 1. Number 2, if they're not on our county website, red flags.
Mm-hmm.
Okay. Number 2. Number 3, but if you still want to engage, ask for some information about that site. If they're asking for legal status or Social Security, run away. Look, we had scams during testing. We try to find those and report them to our district attorney to immediately shut them down. But we try to promote as much of, having valid information so we don't have our folks being scammed.
Okay, Dr. Wooten, did you want to say some things before we started really getting into the questions?
Well, the only thing to Nick's point, everything, I agree 100% with everything Nick said. There is one caveat. Providers, private practices, they can charge the insurance of the administration fee, but they cannot charge a fee for the actual vaccine.
Okay.
So that's the only caveat that I would add. Mhm.
Yeah, because they are asking people for your insurance and Medicare and supplemental, and it's
Yes.
not clear whether they're asking for administrative purposes or they're asking because they want to charge. And this gets to be especially important with the pharmacies like Rite Aid and
Yes.
CVS, because Rite Aid is more charge oriented than CVS. So you need to, people need to know, where they're going and what. One of the questions that came in, which I think has a bearing on what you might say, is people are beginning to ask how many vaccines. So we know there are 2 right there. There might be 3 if J&J comes online. And then there's the question of whether they should take Moderna or Pfizer. And most indications are that they're about equal. And so we have people trying to pick and choose, or if they take one for the first shot, should they stick with that one and not just run and take the other one for the second shot? I think those are some of the kind of questions that have to be addressed as we try to get people to get the shots in the arm.
Well, number one, whatever vaccine is available as the test, rather the vaccination sites, so accept that vaccine. The first 2, approximately 95%, Pfizer actually 95%, and Moderna 94.5%. Johnson & Johnson is 72% effective, but it is 85% effective at keeping people out of the hospital and preventing death. And it was also tested on the South African strain. 72% is good.
If you get it, you might not go to the hospital.
Excuse us for a moment. Someone needs to mute themselves. I can't
But
see.
you can still get the virus, but 84% that you won't get real sick.
Would you please wait until Dr. Wooten finishes speaking? Because
They all mean the same thing.
I'm trying to find out who that is. Okay. Go ahead, Dr.
All right, Dr.
Yeah.
So I was saying 72% effectiveness is still good. When the FDA issued requests for manufacturers to develop a vaccine, they wanted something that was at least 50% or more. And again, 72% is good. And also because it was the clinical trials were conducted, including individuals in South Africa that have been potentially exposed to the South African strain. I think it's a good vaccine, absolutely. So again, 85% effectiveness at keeping you out of the hospital or preventing death. So 85%, I'll take that. And it's one shot. So all of those 3 factors, I think, are good components or good criteria to prove that it is an effective vaccine. But wherever you schedule your appointment, whatever is available, take the vaccine that's available.
Dr. Wooten, can you also speak to Dr. Warren's point that if you get Moderna, you have to stick with Moderna? Because I think I heard Dr. Warren's people may change. Can you speak to the importance of it, please?
No, it's very important. Whatever you start with, you finish with. We don't want people, getting Pfizer as the first dose and Moderna as the second, or even Johnson & Johnson, because Johnson & Johnson is only a 1-dose vaccine. So whatever whatever vaccine was your first dose, make sure that that is also your second dose. And with the appointments that's scheduled, providers will know which vaccine you should get. So that's another reason for why it's very important to schedule your appointments so that we know which vaccines. And for those people that are coming to get their second dose, they are prioritized in any given day over first doses.
Okay, thank you. Go ahead, Dr. Wooten, if you had other points you wanted to make, because it's important.
No, I think, did I answer all, because there were several questions wrapped up into that one. Did I answer everything?
I think
okay,
you did.
Great.
You did, okay.
Thank you.
All right.
And can you just clarify, people probably have heard this already, but just to be sure that we're all understanding, the vaccine protects you from the lethalness of COVID, correct?
So the vaccine is effective. So if you had 100 people in a room with the Pfizer and the Moderna, 90 of those individuals should be protected. So it's 95% of those people should be protected from getting the virus. Now, what it is not clear as to whether or not this was included in the trials is whether you can be protected from getting the virus, but if you are an asymptomatic carrier, can you transmit it to someone else? And they are doing additional studies to look at that very point. So it's not 100% known where we are with that, but additional research is also currently being done to look at that. I do believe that the Johnson & Johnson did look at that.
Okay, so it does protect you from contracting COVID. I'm sorry, go ahead.
Yeah, Ms. Ross, to your point, and I think Dr. Wooten stresses this, and I'm sure she'll stress it again here. When you receive your vaccine and you get given your second shot, it does not mean you can't get infected by COVID, the virus itself. You indeed can, and then it's still very prevalent. That's why what we're talking about, though, is the ability of not getting very ill or, God forbid, seriously hospitalized, right? Or even more fatal. And so I'm not the physician, so that's about it, Dr. Wooten, but that is why we continue to preach your mask covering and your physical distancing and, and the good public health measures, because even people that right now, the false sense of security, right? Hey, I got vaccinated, I don't need to. No, you can still get sick. And so that's why, we still have a ways to go with all the public health measures because of the prevalence of the virus. But Dr. Wooten, I know you preach this all the time. I give you the last word on this one, in particular issue in terms of the MPIs.
Absolutely, Nick, you are very correct. No vaccine is 100%. The closest to 100% is hepatitis A, and that's after 2 vaccinations. So after 2 dose series for coronavirus 19, or COVID-19 rather, 95%, essentially 95% effective for both. That means if you're exposed to someone, 95% of the time you will be protected. But there is that off chance, a 5% chance, that you could still be infected. And as we tell people with flu shot, your symptoms may be less severe and the duration may be shortened, but you could still get infected. Hence, you could still infect others. So that's why it's very important after the first dose and after the second dose that you continue to practice the preventive strategies, washing your hand, watching your distance, and wearing your mask. So that's very, very important. We do not have herd immunity yet. That's the other reason why it's important to practice those strategies. And then the third reason why it's important, we don't know yet if the vaccine can prevent you from becoming an asymptomatic carrier and then transmitting it to others. It prevents you from, it's effective against your becoming infected and getting sick, but the latter part, there's still additional research. So all of those reasons are important for you to continue the preventive measures after you are vaccinated.
Dr. Wooten, I want to raise an observation for you. There are people that I've met in the community who have made it very clear, and even in our meeting recently, Black Men and Women United, we were discussing this meeting, that they're not going to take the vaccine. They don't believe in taking the vaccine. And I understand that's a choice. But my concern is that those very same people, because they don't take the vaccine, they're at risk as being greater spreaders of the virus. And so we need to say a word to folks, especially with family and loved ones, if they're not going to take it for your own self-preservation, then there has to be a change in your conduct.
Absolutely.
And I know of a particular family where the mother and siblings didn't take the vaccine. I mean, don't want to take it. They have COVID. They quarantine, and the family members who did take the shots are wise enough only to go to their doorstep and leave whatever it is, but not to go in to visit. So we need to remind people of the risk of folks close to us who, for whatever their personal reasons, have decided not to take the vaccine, but they're at risk of harming more people. And maybe you can say a word about that. I know it's not totally medical, but I think it needs to be put on the table.
Dr. Warren, you're right on. For those individuals that have decided not to get vaccinated, but they in turn then become infected, they do, it is, again, research doesn't know, we don't know how long they will have immunity. That's why CDC is recommending that even individuals that have contracted the illness, they should get vaccinated at about 90 days after their symptoms have resolved. So that's the important piece. So you're absolutely right. If people choose, if they don't get the disease, if they choose not to be vaccinated, they will have to change their behavior, because they will have to continue to wear masks, the social distancing and the hand hygiene, because they could potentially become infected and spread it to others. So if they become ill, however, we want them to isolate, their symptoms resolve, and if they change their minds, we want them to get vaccinated about at least 90 days out. But if they do not get vaccinated in the long term, then they are going to have to change their behavior and do the things that we talk about every press conference in terms of distancing, wearing facial coverings and washing your hands, and staying home if you're sick. That's another really, really important factor. Many people go to work, and we understand they are weighing the risk of losing a paycheck versus staying home from being sick, and everyone's going to take the former every time. So it's a challenge, but doing the right thing is to get vaccinated.
Okay.
Dr. Warren, can I add?
Go right ahead.
The reason why many months ago we added some supports under T3 to support Dr. Wooten's point is that we know some people have to work to make money to pay the rent, pay the food. And so that's why, for one, we have nearly 1,000 people currently in our 7-day average in our public health rooms. I think over 5,000 from my numbers, approaching 6,000 folks that we've helped, where we'll provide 14 days of stay at a public health room with food, support, Wi-Fi if they have kids, the whole family. And also on top of that, some families are not taking that. We knew because they didn't have a form of income because they couldn't pay the rent, when they're away at a public health room. And that's why we did the income support. And it's not the laborsome, government eligibility. And we did that, and there's a lot of people we've helped as a result of that. This board, proud of this board, they continue to support that effort. So there are supports out there. And we encourage people that if they're in that situation, that there are things we can provide locally to help.
Well, Nick, I wanted to make an observation too, because people might see Tanya and I sitting here without masks, and we do wear masks, and we are family, and we have a controlled environment here within where we are in the building. No one is in, and the people here are checked and tested, and so we only are without our mask during this particular meeting, but because we are a family household and we're all following protocol,
Yes.
that's why we have this. So I didn't want people to think that we were taking one thing and not doing another. Okay, so we have been very rigid with this, and I must say, because we've been so careful with it, it's one of the reasons that I've survived, because, as you know, my recent bout with pneumonia, they indicated that if I had had COVID, I would have passed because I couldn't have survived. But it's because we've been so very careful with this. So I just wanted to put that out. We had a question too, Dr. Wooten, because it's coming up about when will the teachers get vaccine. And I think the governor today was talking about a new supply supposed to be coming into California. So there's a real strong that teachers should be priority. Can you address that?
Oh, absolutely. The next group of individuals that we want to vaccinate include our emergency services, which includes law enforcement, firefighters, and individuals that are responding, such as myself. Then teachers or educators and childcare, and then food and agriculture. Those three essential service groups are next in line when we get additional supply of vaccine. And we've heard at the federal government level that they are increasing the percentages of vaccine. What they're doing now is looking at how to get an additional dose out of Pfizer, as well as there are 5 doses in the Pfizer vials and 10 doses in the Moderna vials. So the goal is to get 1 additional dose per vial. So that is happening. And the other thing that we definitely know will increase local volumes of vaccines is the new Johnson & Johnson product that will be shipped out after its approval, and we hope it will be approved, but it will be reviewed on Friday, February 26th. So if the FDA Advisory Committee approves, then FDA Director approves, and on Saturday, the 27th, and CDC, they have an advisory committee, and then the director will approve, and then vaccines will start to be shipped on that Sunday. And hopefully beginning of March, we will see an increase in additional vaccines from a third product. I can tell you that in the past several weeks, we have only got 25 to 30% of what has been allocated to us. So when we say we don't have enough vaccines, we really don't have enough vaccines. So that's why we haven't opened up the other categories, because we don't want to open up those spots and not have vaccines. People make appointments, and then they get to the vaccination site, and there's no vaccine available. So we are tightly monitoring supply available and then vaccination spots available. And then there's a delicate balance that we have to make between individuals that are scheduling second dose appointments as well as first dose appointments.
Okay.
It may be too soon to tell, but do you think that most people will have the vaccine, at least be able to get vaccinated?
Yes.
By the summer, around the summer, or will it be more like the fall?
Well, the national goal is to have populations vaccinate, 70% of a population or jurisdiction vaccinated by July 1st. Obviously, San Diego wants to do that much sooner, but that's where we are at this point. This is the national goal. And this is just numbers calculated with the current 2 vaccines that are available. So we have a population of 3.4 million. Only Pfizer is approved for 16 and 17 years of age. So the population in San Diego would be approximately 2.7 million. And if you take 70% of the 2.7 million, that leaves you with 1.9 approximately million individuals that need to be vaccinated. And considering there are 2 doses, we have to administer almost 3.8 million doses of the vaccine, which equates to about 22,000, almost a little less than 23,000 vaccines per day. Now, we have the capacity, but again, we just don't have the vaccines.
Yeah, to add, Ms. West, what's really frustrating, and I know Dr. Robinson's been waiting patiently, if I may, Dr. Robinson, real quick. So this is where, the governor was here earlier this week to recognize the work that our community has done. And it wasn't, and it was commented on not just putting up super stations, But what we're proud of is, most public doesn't realize, on January 1st, on New Year's Day, we stood up county vaccination sites, smaller sites throughout the county, and we've added more. And Tub and Chavez, we're turning that from a testing to a vaccination site. As 2 days right now for vaccinations, soon to be more, as we're looking for working with the Jacob Foundation, perhaps to do something more grand there. The reality is, it's how we follow the health equity. So it's one thing saying it, it's nothing doing it. And we did it for T3 for testing. It was extremely important. We did the same, and just following the same lead. And so we built the infrastructure currently, to Dr. Wooten's point, to do about, today, 21,000 vaccinations if we had the vaccine. What we're averaging is about 12 to 13,000. Not because we're not capable, it's because we don't have enough vaccine. By the end of this month, with more sites, there'll be more sites in the city of San Diego, more sites in our health equity communities. We'll get to 35,000. If we had enough vaccine for all that 35,000 a day, and there was truly the public demand to fill those, we would get to that 70% threshold by May. Let me say that again. If we had the vaccine, we would get there by end of April, early May. And so what's frustrating is that thank you, Dr. Wooten. What's frustrating is that we don't have the vaccine. So the leadership, the chair, Nathan Fletcher, and our vice chair, Nora Vargas, have been steadfast of, we build the infrastructure. We continue to do that and build it in the right places. So you could see the progress we've made, and there was even progress made earlier than February 1st, but this was the latest update we provided for the board of supervisors. But you could see this is the health, what's called the Healthy Places Index. It's where the virus has more adversely impacted. It also looks at places where people have less advantages to access to care, or in terms of socioeconomic vitality and so forth. And so we were looking at, and where we developed our sites initially also, were immediately, and no surprise, in the South Bay area, which has been most adversely impacted, but building it still throughout. And in doing this, this has also caught the attention of the governor. It's caught the attention of others, saying, you know what, if we're needing a community that can really get vaccine out quickly and appropriately and in an accessible way, then go to San Diego. And so I think it matters, because there are some jurisdictions, unfortunately, maybe they're not able to have a community like ours that comes together and says, how do we figure this out? How do we do this? How do we get people to come and get vaccinated? So we have a long way still to go, but I think we're blessed, at least in San Diego, of getting ahead and realizing we're racing to save lives. And so, and doing so, caught the attention now, people saying, just give us the vaccine, and we'll take care of ourselves in the community. So I just wanted to enforce that point. The Biden administration just released that the president himself has said that every American will have vaccine by summer, enough vaccine by summer. We want to be done by the summer, well before the summer. That's our goal for San Diego.
Okay. Dr. Robinson?
Yes.
Did you have?
I had a couple questions for both Nick and Dr. Wooten. I've looked on your website, and certainly equity is a big issue, and it's an issue around the country. Also, vaccine hesitancy is a big issue. A few weeks ago, it was published in the Union Tribune that in the fire department, when they were passing out vaccines, there were 191, I believe, firemen who refused the vaccine at that time. Now, when we look at your statistics, county published on your website, of those vaccines that have been passed out in the African American community, it's about a little less than 2% of those who have received vaccines have been African American. In the Hispanic community, it's been somewhere around 13%. African Americans in San Diego County are about 5.5%, and Hispanics are about 33%. So this equity problem still exists. Also, vaccine hesitancy may be a part of that, but is there a county program that is going to deal with how do we bring the message that people should get vaccines and be vaccinated in the county? And how do we actually deal with those numbers that we currently see from your website?
Well, I'll let I think Dr. Wooten and I both would love to. Great question, Dr. Robinson. So I'll let Dr. Wooten explain why the numbers may look like the way they do now. And then I'd like to answer the question about what are we doing about it. So I'll turn to Dr. Wooten first.
So thank you, Dr. Robinson, for that question. First off, no matter what the vaccine is, we cannot make people get vaccinated. So we place vaccinations in the communities that are at greatest risk, and that's what we have done with testing, now vaccinations. They are in the Healthy Places Index, and particularly those communities that have lowest resources. And so that is seen, and we showed that graphic earlier. What I have up now is indeed our information that we have. We stratify all of our data, no matter what it is, by 5 lenses: age, gender, geography, race and ethnicity, and socioeconomic status, if that's available. That's not available for these data, but we have the first 4. So you will see pretty much what Dr. Robinson stated. But also, if you look at the 2 rows at the bottom, other races is 15.3%, because many individuals might be biracial and do not want to pick one race over another, so they will choose other race. And then race and ethnicity unknown. And you see the percentages there. Many individuals do not want to document their race and ethnicity. And again, we can't make people do that. What we can do is educate individuals, asking them to provide this information to us, because it helps us to better identify who's in need or who needs to have this service. But again, we cannot make people provide this information, and we cannot make people go and get tested. So I'm sorry, make people, but the same thing follows for for testing as well too. But in this particular case, we cannot make people get vaccinated. So
I understand.
I'd like, if I may add, Dr. Robinson, so what are we doing about it? So we saw the same thing happening in testing, Dr. Robinson, when we started. Remember Dr. Warren reaching out to me with a lot of concern in that same regard, both from how we reflective of the people doing the testing to the people getting the testing, right? And so we worked hard on how do we do that from the workforce lens, at the same time realizing we needed to have our community partners. So not only did we work with Voice and Viewpoint in all of our papers in our media campaign, more importantly, we worked with the Multicultural Foundation with Dr. Hood. We worked with Mental Health America, Latino Healthy Coalition, that's made up of about 10 Latino serving organizations. What we tried to do is get with, and also our Pacific Islander community and our refugee community, and lead organizations, all community-based organizations, who did a really job for testing and promoting the testing. We're using the same groups to help us with the issues of vaccine and the promotion of that. And then, just more recently launched the Promotora program, where we're trying to help people in the community have difficulty registering for appointments. People who don't speak the language or don't have the digital divide, not having the technology. So 211 also for elderly who don't know how to navigate, a computer, helping them make appointments. So we're making every concerted effort, and still more to do, on getting to people who are not showing or for hesitancy or because of the inability of knowing how to navigate, helping them navigate with them. And
Nick, to your point, outreach is the best way to get to the community and go to where people are. And having and continuing community forums like this, the county participated in a community forum several weeks ago with Dr. Hood. And we did a polling beforehand to find out how many individuals would get the vaccine. And after the presentation, it was myself giving the stats, Dr. Hood talking about the results from our county-driven survey, and then there was another speaker from the military who actually participated in the Pfizer trials himself. So he had that experience. So that he could tell people not what we've read in the research, but what actually happened to him as a participant in the clinical trial. It was an excellent panel discussion, and then afterwards the survey there was a poll, so it was a 10% increase. It went from about low 70% to about 86% individuals who were on this call then said that they would consider getting the vaccine. So I just think that more activities and opportunities like this to educate the public. And another thing that that I actually stress to the individuals, don't listen to what your friends or your family say. Go and find the research and read it for yourself. So that's what I encourage everyone on this call to do. And if there are trusted and valued experts whom you revere as being an expert, rely on their but if you have questions, you can ask them to help you understand this entire process and make an informed decision for yourself.
Dr. Wooten, we have about 14 minutes left and we have two people up. Dr. Bill Lash, you have your hands up, and after you, Councilman Bryan. So we want to be respectful of trying to get you both in. Dr. Bill Lash, would you go ahead, please?
Thank you so much. I won't take much time. I appreciate this. I just wanted to thank Voice and Viewpoint. I'm lived here for about 10 years in San Diego. I'm from out of state. I'm a board certified OBGYN. I won't say much more. But I did go to the gala on Sunday. That was the first kind of introduction to your groups, and appreciate your having this. I am a board certified OBGYN with a great deal of research experience. I work mostly as a contract physician out of state. I put in the chat just some issues that I would be interested in talking about at some point. And so I won't say too much for that, other than I would volunteer my services on those times I'm available. And individual physicians, private physicians, I think have had some difficulty because we've been getting our information off the TV set by mostly non-physician people. And I'm well aware, because I've been reading between 2 and 50 papers a week over most of the year to get up to speed about this. And there's so many details, so much we don't know, and everything seems to be 3 months behind by the time we get there. So first, I would just offer, if you have any interest, I would try to be of help. I believe I have some expertise to offer, but I do have a pair of hands also. And I just put some of these issues. These are the things I think would be useful to kind of iron out in the long run, maybe not in the short term. And I'll stop there.
Okay, let me just say too that this week in our paper, we have a number of questions, and one of the big topic areas were whether or not pregnant women should get the vaccine. And so there is an interest in the area that you have expertise in, and we will try to see if we can arrange a time to come back and maybe devote more time to that. We
Sure.
also had a question come up as to whether or not there were children in the trials, and it was my understanding that children had not been added to the trials to the extent that efforts they want to, because everything is kind of being done as the plane is going down the runway. And then we had a question as to whether or not the vaccine would be mandatory for teachers. And I haven't seen anything that suggests at any time that anyone is going to be forced to. I think that becomes an issue of the school policy decision makers working with their unions as to how they handle that. But that's not a state issue up front, I believe, in terms of initially how that might start. And so we're going to keep the door open, and we want to thank you, Doctor, for your input.
If I could help, because I think, you know, all these vaccines are not the same. And what has made it difficult is that the information comes out piecemeal. I mean, I read between 20 and 50 papers a week devoted to these topics, and you're trying to weave it together. And so I would be very interested in whatever I can offer, or being at a more fundamental level, so that we do get more accurate information. I'm pretty supportive of the Moderna vaccine in terms of people's fears for adverse effects, but those issues need to really be parsed out in a more particular manner. And if I could be involved, I would like to. As I say, I'm a contract physician. I work out. I probably this next month would have some time.
Well, we'll follow up with you. In the interest of time, Councilman Bryan, you were next, and we wanted to make sure we got your concern.
Yes, and I actually just want to say something. I'm not a councilman in San Diego. Obviously, you guys know that.
That's okay.
I'm in Riverside County. I grew up in San Diego, which is probably one of the more powerful stories of what I went through. But I'm a councilman here in Riverside, San Jacinto. I actually had the vaccine shot. Reason why, one, I'm not a big fan of vaccines, but I know that as leadership in our community want to help instill confidence. Plus, I've done a lot of research on it. I've talked to a plethora of doctors. You know, I meet with many individuals, but I wanted to say something regarding information now, because so many people, and I was looking at the charts that Dr. Robinson has brought up as far as the African American communities, and I speak to, and I've been to the Dodger Stadium, and I've been to different, and I've talked to so many different people. So to get to that percentage of number, as far as what Dr. Fauci is predicting to open up the full country, I don't see it happening, given the fact that a lot of people are just more fearful. I think you alluded to it earlier about the Tuskegee experiment. Nobody want to be a guinea pig. But one of the things I do want to encourage is that, everybody has to be on the same page when it comes to the information being given. Because if you have, just like I think you said something about some 100 so first responders refuse to take it, and that instills fear right along with individuals who are now already apprehensive. Because if you have your first responses and you have doctors, because I even have doctors that are telling their patients not to take the vaccine. And so, there's a huge fear that's coming from, the same people that should be working together. And I think that that's such an important thing that we need to start addressing, is that everybody being all the way on the same page to where people feel confident in it. And so I just wanted to share that. That's something that we're doing in our community. I'm working with our local Chamber of Commerce. I'm also a pastor of a church too. So, I wear two hats. But I make sure that we're working with everybody in our city and our city supervisors to making sure that we are getting that information out while we're waiting for the vaccine. So instilling confidence, because we don't know when we're going to get. I know today President Biden just signed another $200 million with Pfizer to get vaccines in. But while we're waiting, this would be a good time to get out in the community and start really educating people on the vaccine. So that way people feel more confident in it.
Thank you. What did you say?
Did Dr. Wooten or Nick, would you like to
respond?
This is Dr. Wooten. I just wanted to make one comment in regards to the statement you made, Dr. Warren, about children. The only vaccine that is currently approved and being utilized is the Pfizer for 16 years of age and older. Currently, manufacturers are or will be looking at younger children and conducting those clinical trials, but that probably won't happen for another year or so. So the vaccines that we currently have available to us, there's only one that is approved for individuals less than 18 years of age, and that's the Pfizer. So it's from 16 and older. And all of the others are 18 years of age and older.
Okay.
Just to inform people, those trials are they're ongoing right now. The doctor who was on the program a couple of weeks ago, Dr. Gaffney out of the prison system, his daughter is in the trial, and she's young, and he was also one who was in the trial. So those trials are going on.
Yes, Dr. Robinson, but they probably won't be available until the end of the year or next year. So that was my point. They just aren't available right now, and there's no vaccine for children that are less than 16 years of age. Thank you.
Well, go ahead.
Right. No, you go right.
Well, I would just like to say that, I took my mom to get vaccinated. She just had her second shot at the county site on Ocean View. And I just was so impressed with how helpful everyone was, how reassuring the nurses were. It didn't hurt. She doesn't like needles. It was quick. And so it's a very easy experience is what we experienced. We had to wait a little bit for the second shot, but I would definitely say to everyone that I was so impressed with the nurses and the facilities, just the helpfulness and the just making everything very comfortable and reassuring was really, really nice to observe.
And this is important because on Ocean View, you have comprehensive health with San Ysidro right next to the county where she got the shot. So you have two different setups there. And that can become confusing to people when they do 211 in terms of which entity they end up with. But it was a good experience, and so we are glad that she did get through. Yes. We're kind of winding down in terms of time. We have a couple of minutes left here because we had set aside an hour to do this. And so I don't know, Dr. Wooten and Mr. Macchione, if you all have any closing comments you want to make. We can always do this again. We have no problems with scheduling it. We get inquiries, we will open up and keep this as an ongoing thing. We want to remind people that the Voice and Viewpoint is one of those entities publishing the county health ordinances every week, and it's going into over 2,000 food distribution units in all of the sites in the community, because everybody is not on the internet, and so we're giving people hard copies that they can see and read. As well as the paper is available at no cost on the internet. You just have to go to it. So we want to make those things, keep those items in front of the public. Dr. Wu.
Well, Dr. Ward,
yes.
Yeah, if I may want to just first thank you, Ms. West, for hosting this. And as you know, my Friday's comments, they were just sincere as your recognition of the nurses and the nearly 6,800 men and women of the Health and Human Service Agency. They pour their hearts every day to do this, and you know, they're our neighbors, they're our moms, they're us, and they're there committed to protecting lives. And so it's hard. It's been a long drawn out for all of us, particularly our frontline clinical folks and our public health nurses. You know, the councilman had a great point, and it reminds me of the expression of to go fast, go alone, to go far, go together. And as you're in Riverside doing, council member, we are in San Diego doing the same. It's easy to go fast and set up a super site or that, but you have to go together. And so, you know, going together with the community and being invited to be in a community. We have more that we'll be setting up. And I worry a lot about homebound seniors and people with disabilities. And so we're working with programs to go into homes. And you know, and that's the part of a real character of the community, right? How we come together when we are in crisis and how we help one another. And indeed, that is what's happening here. And it's not that we're boasting that we're leading even LA per capita in San Diego. No offense to Riverside, you guys are doing great, but we're number one in the number of vaccinations. But you know what? By blessed God, it's because we got vaccine and we're doing it. But you know, we got to help each other out. But we have a long way to go. And I think, Councilman, you said it during this time on this journey, knowing we're all together on the same team, that there isn't anyone trying to hurt and or hide data or give it to certain groups and not other groups. Not at all. And I think we've demonstrated that large part with how we manage ourselves with testing and tracing and treating. We're just doing the same now for vaccine. And as we open up to the community, we will have more communities of color getting vaccine. I'm confident of that. And we have to. And so I just want to appreciate you both, Dr. Warren, Ms. West, and all of the folks that are joining tonight for your time. This it matters, and I appreciate that. So, Dr. Wooten, you the last word.
Well, thank you, Dr. Warren. We really do appreciate the opportunity to share information with the community to help them make an informed decision, because that's really what it boils down to. People may remember during our hepatitis A outbreak, there was initially a slow uptake by our homeless populations and our populations dealing with the drug users. But after a while, after our nurses kept going out and talking to individuals with our hot teams in the community, people began to trust county and began to uptake or take the vaccination. So we're going to have the same process here. And as Nick has stated, because of the partnerships that we have 7 contractors for outreach and education. We have case and contact tracers for contracts there. We have a program between Public Health and the Emergency Operations Center called Project Relay, which is 7 community language communities where we give them information and they push it out to their constituents because they are trusted and valued members. So it's going to take every resource we have to educate the community so that they do feel that there is no conspiracy theory, and that the one thing we want people to know that the vaccines are effective and they are safe. So that would be my last word, in addition to just continue those 4 W's. Wash your hands, watch your space, and wear your mask.
All
Good
right.
evening.
Well, we want to thank you so much. We stay within your time frame. We're here to come back and do this anytime you might choose to do so. And we really appreciate it. And we're going to follow those 4 W's, Dr. Wooten. All right. You all be blessed and have a good evening, everyone.
Right.
Thank you.
Oh.
Good night.
God bless you all.